Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jen Stallings.
Today's Health Talk program on WHAR, brought to you by Mon General Hospital, is going to focus on the Relay for Life, which is coming up in the very near future. And Mon General is a very big part of the Relay for Life this year, along with the new Zelda Stein Weiss Cancer Center. We're going to be talking about that today. We want to introduce our guest to the program today. We have Leandra Hickman, who's the community manager at the American Cancer Society. Good morning.
Good morning. Thank you.
Welcome to the program. And also in the studio is cancer survivor Opal Huggins, and she's coordinating this spring's Relay for Life event. Good morning.
Good morning.
All right. When is the Relay for Life coming up?
It will be held on May 31st at Milan Park Expo Center.
Okay, is that the holiday weekend? May
It is
31st?
the weekend after. So
Okay.
Our theme is actually Freedom from Cancer. We're hoping that people can reuse their decorations, their red, white, and blue, to decorate their campsites at the event.
Relay for Life has grown nationally over the years, and I remember the very first ones here at the WVU track.
Yes.
And it's really kind of a unique fundraiser. It's not like any other relay. Explain how it works.
It's actually the biggest fundraiser in the world. Over 4 million people take part every year in over 20 countries. How it is set up is that it usually takes place at some sort of track area, and teams are formed, usually friends and family teams, businesses can form teams, schools, that kind of stuff. People form teams, they fundraise throughout the year, and then they show up on May 31st for relay. They have a campsite, so everyone is set up in a circle around the track. People walk constantly throughout the event, and the teams do different fundraisers like selling food, playing games, and people can stop by. It's really like a carnival fun kind of atmosphere.
Opal, good morning.
Good morning.
All right, I want to first get your background story a little bit. Tell us about cancer and your life.
Oh, well, I was diagnosed in the summer of '06, and I found out I found a lump one night, and the next day I was at my general practitioner's, literally the next day at the surgeon's, and life changes very quickly.
So you discovered the lump, which means that you discovered it, the doctors discovered it early?
Unfortunately, mine was not discovered as early as I wish that it were. So I really want to say to women and men too, I didn't know that men could get breast cancer. That was my initial diagnosis. Do those self-exams and do the mammograms and things you need to do. I did not. Mine was somewhat advanced when it was found.
So did you know prior to 2006 and being diagnosed that you needed to do self-breast examinations and needed to check yourself? Were you educated a little bit about what women need to do to take care of themselves?
I can't plead ignorance. However, knowing something intellectually and doing something is not always one and the same. I had actually found myself unemployed and without health insurance, so I kind of put it on a back burner. So I have to take some of the responsibility for not staying on top of this. But with that said, I'm doing very well. I have a wonderful, wonderful oncologist. That would be Dr. Saunders, and my care has been excellent with him and with Mon General.
Well, speaking of medical oncologist by the name of Dr. Darrell Saunders, we have a guy that matches that description right here on the air with us. Good morning, Dr. Saunders.
Good morning. How are you?
We're doing just fine. We just learned a little bit about Opal's background, and let's talk to you first of all. Have you been with Opal the whole time since her diagnosis in 2006?
Yes.
And Opal, I want to ask you about your initial reaction. Did you think it was a death sentence, a death knell? Did you always remain positive?
Well, I did. I did. As soon as you hear cancer, whether it's breast cancer or whatever, but yes, as soon as I was diagnosed, I'll never forget being in Dr. Mark Johnson, the surgeon's office, and I kind of knew. I don't know how I knew, but I just had this feeling that, and I like to think that I'm an optimist by nature, but yet I think I knew what the diagnosis was going to be before the pathology report came back. But the initial thing was, oh my God, I'm going to die. I'm going to die like now. I didn't think I'd ever see, my grandchildren grow up. I was devastated.
And Dr. Saunders, when somebody discovers a lump in their breast and come to get tested, what do you do at that point? I mean, obviously you've got to calm them down a little bit because everybody probably thinks it's a death sentence when they're told that they have cancer.
Generally, they already are aware they have cancer when they see me. They've seen the surgeon. They've had a biopsy. They've had various studies. So I try to. First, you have to do what we call staging the cancer, see if it's advanced or if it's localized. You might talk about primary therapy of the breast itself, trying to assure patients that you're going to help them as best you can, even if you can't cure them, so to speak. Breast cancer has become a chronic disease, as Opal has. She's a tremendous fighter. She's a role model for many patients, and she's a wonderful person to take care of. But I think you have to look at each patient individually, try to assess them and their family, the support that they have, and try to work out a process. Patients want some kind of plan, and they want hope.
Tell us about your treatment plan for Opal.
I don't know if I should discuss her own personal treatment plan. That would be up to her. But generally, patients with breast cancer get some type of hormonal therapy, drugs called tamoxifen or Arimidex, after they have the primary treatment on their breast. Many patients get chemotherapy, which are IV medications. There are certain types of breast cancer that respond for years with these treatments. And I have patients, I've been doing this for 32 years. I have some patients with breast cancer I've seen for over 25 years who are survivors and doing well.
Yeah, we've certainly done shows on treatments with breast cancer. Lumpectomy comes to mind. Mastectomy comes to mind.
Correct.
So, Opal, you don't have to tell us. I mean, it is personal information, but if you want to tell us how you were treated.
No, I don't mind sharing. If my story can help anyone else, I'm willing to do that. I did have, I had a mastectomy, and then you have to have a short healing time. It's been a while. I think it was about 6 weeks after that I started on chemotherapy, and let me tell you, that was an interesting walk in the park.
Yeah. And we've also done shows on reconstructive surgery. Did you also go through that as well?
I did not. I kind of, if I were a younger woman, I suppose I would have, but I chose not to go that route. Actually losing my hair was probably more of a big deal to me than losing a breast. I don't know that anybody could tell. They have wonderful prosthetic devices that you can wear. So, no, I chose not to do that.
So you take the chemotherapy, you lose your hair, you lose your breast, and all the meantime, Dr. Saunders is checking on you. And is there come a point where he says it's gone, or its tumor's very small now, or what was the positive news that came out of going through all that?
This started for me in the summer of '06, and I had chemo until I remember it was almost right towards the Christmas holiday, and I thought, wow, I'm done. There's something to be said for being naive. It turns out that I was not done. We thought, because, I had a PET scan after that, it looked like I was cancer-free, and I think I had about a year and a half that I assumed that that's what the deal was, but it came back.
Well, Well, when we come back from the break, we're going to talk to you about why you're involved in Relay for Life. I mean, we could probably answer that for you, but we want to hear it from you. We can understand why you would be involved. The Relay for Life is coming up, and May 31st, I think you said it was, right? Okay, and we'll talk more about that coming up in just a moment. Dr. Darrell Saunders is our guest. Also, Opal Huggins is a cancer survivor. And we also have in the studio Leandra Hickman, who is the community manager at the American Cancer Society. We'll be back to Health Talk on WHAR right after this.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Relay for Life is coming up on May 31st, and cancer survivor Opal Huggins is in the studio this morning, along with Dr. Darrell Saunders, medical oncologist, and Leandra Hickman, community manager at the American Cancer Society. Jim Songs along with Kay Murray.
Yeah, Opal, I wanted to ask you about life changes quickly. And going through some of this with two sister-in-laws, it does. And maybe you can talk a little bit about that. And from the time that you knew that you had cancer, in what ways did you feel your life changed?
Well, like I had initially said, at first you're just so overwhelmed and you think, oh my goodness, how long do I have? I chose not to stay in that spot for very long. You can't. And then I was fortunate that I had a schoolmate friend from back in elementary school, and that was many, many millions of years ago, that I contacted him. I tried to educate myself as much as I could, and then just started working with Dr. Saunders and the wonderful team of people that he has with him, and kept on going on, and that's what I'm still doing.
And I'm sure you live with this every day, and you probably think and breathe it, but how family plays into this, and you have a wonderful grandson in the studio today, and how your grandchildren and all of that makes you want to fight more, I'm sure.
Oh, absolutely. I'm fortunate enough that my grandson, Hunter, lives with me. I have two other granddaughters that are in Morgantown that in the beginning I saw a lot of them, and I was fearful for them because they're young women. But anyway, family has been my motivation, and especially co-parenting this young man that is my inspiration to get out of bed every day, and to, if Dr. Saunders told me I needed to stand on my head and do jumping jacks, somehow I'd figure out how to do it. So,
tell us about your first Relay for Life event. What year was that after you got, was it after you got diagnosed you had attended your first Relay for Life?
It was. I'm amazed at how ignorant I was about what happens with people that have cancer in the area. And I hate to say that because I was a social worker and still was not aware of how it impacted everybody's life. And Kay, you're right, it's a family disease. It's not just the person. But back to the first relay was the first summer that I was after the first summer, because I wasn't diagnosed until I had missed it by about a month and a half. So, I had a little bit of time under my belt, not even a year, I would think, that first relay. I remember like it was yesterday. My friend was there with me that I had learned that she was 3 months ahead of me with a cancer story, and Paula and I were in the front line. It was the most emotional experience that I think that I've ever had. You're there, there's a crowd there cheering you on, and I don't ever want people to feel sorry for me, but it was just when you're walking along, I cry at the drop of a hat anyway, but you see all these people clapping, and you know that they're there for you. You don't know their name, you don't know anything about them, but it was so empowering, and
Well, that's why I wanted to ask you about these life changes, because I've heard that story before. You make a whole new connection with people. You truly do. And you get to know how important a community is. And you get to do connections all the way around through doctors and people, fellow people that have cancer. And you get to know them intimately.
Absolutely. Your circle of friends changes very quickly. At some point after the cancer returned, and Dr. Saunders had mentioned hormone therapy, Arimidex, tamoxifen, that didn't work well for me. So I went back on chemo for I don't remember exactly, a few years. And I was in his office and in the infusion room. An infusion room is where you go get your chemo and your treatment once a week. So those people, and I understand boundaries to some degree, but they are also wonderful, and they become your cheerleaders, your support system. And then, of course, the people that you meet there, the other people that have cancer, whether it's breast cancer, whatever, you become each other's cheerleaders. I remember a time when I first started getting chemo, I would sit across from the same woman every day. And one time a fellow made the mistake of sitting in what I termed my chair, and I was bold enough to say, hey, I have to sit here because I had to watch my friend Pat. We kept an eye on each other. You become intimate very, very quickly.
Connected, yeah.
You mentioned you were in the front line of that very first cancer walk. That's the survivor's walk, if I'm not mistaken, right?
Yes.
And how many were in that survivor's walk? Do you remember?
Oh, I don't. It seemed like maybe 100 or so, probably.
The good news is it probably grows every year. At least you hope it grows every year, the number.
It does grow. And one of the neatest things about that is when you go back and you see the same people and you're like, wow, they're still here.
Dr. Saunders, tell us how you think that Relay for Life makes a difference in the lives of your patients.
I think it's a time that patients can get together with their family and friends and other cancer survivors and realize that they're all fighting a similar battle. It's a very hard journey for all of them. And I think it just gives them a lot of support, community support. It's a very good psychological boost for them. And they become friends, as Opal said, many of them. And I just think it's a good thing for the community, the patients, and sometimes the doctors go as well, and they can see their doctors in a different type of setting. And it's just a good community. Yeah.
I'm going to ask you a very esoteric question here, and that is, do you think the power of positive thinking is real?
Of course it is. I mean, I think that's true for any type of medical illness. I mean, people that have positive attitudes, want to get better, can get better. People with cancer fight every day that they have this dreaded disease. And if you have a stroke, you don't get better if you don't have a positive attitude. I think just in your general day, if you're always a downtrodden person, you're not going to get better. You're not going to be able to do your normal activities. Most people with cancer are fighters. And I think that's what makes a lot of people keep on ticking, so to speak.
Before I take the break, Opal, did you want to add anything about the power of positive thinking?
It's paramount. One has to think positively. If not, I don't know that you make it. And I've seen people come in with this foreboding attitude, and I didn't see them anymore after a while.
You're listening to Health Talk, brought to you by Mon General and WHAR. We will be back right after this.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
We'd like to thank Dr. Darrell Saunders for being on the show. We went and let him go because we want to focus now on the Relay for Life event. And Leandra, tell us again where it is and how we can participate, first of all.
You can participate in a number of ways. We are always looking for new teams. So if you have a family and friends team, if you're part of a church or a school and you want to start a team, you can sign up at relayforlife.org/MonWV. That'll take you to our website. Also, businesses, we're always looking for sponsorships, even just one-day fundraisers that you guys want to do at restaurants or things like that can just come to the event. We're just looking for people to take part. And also survivors, we want to make sure that we can reach out to any survivors to come do the survivor walk and the survivor dinner that happens the day before.
That was a pretty long web address that you had there. Is there a telephone number or a location or anything we can get more information from?
If they want to call our local office in Morgantown, they can call 304-296-8155, and we can give them information on anything.
296-8155.
Yes.
And we could sponsor Opal if we want, right?
You could if she is signed up as a survivor, you guys could make a donation to her as a participant. Yep. Yes.
We're out of time for today. Thank you so much for sharing your story, Opal.
Thank you, Opal.
Thank you for having me.
Now, stay tuned for a news update in Morgantown AM on WHAR.